I tell you guys that the differential between biliary colic and ACC is important. Oh, you may ask, oh, Dr. Bharathi, this is not even that big deal. It is very trivial because biliary colic will absolutely lead to ACC. Then why we have to know it in a different way? But guys, I tell you, because the management differs. How you treat a patient differs, and also associated comorbidities will, yeah, that will actually plays a role like in all other diseases. But the thing is, you need to know the differential between these two things. So for medical school it is fine if you don't know this, but right now just listen to me, you will understand. Okay, so as I said, this colicky pain, actually it is not colic, it is actually a constant pain. I mean the characteristic of pain I'm explaining. So it is a constant pain in the right upper quadrant which occurs like half an hour after taking a fat meal, right? A fatty meal. Why particularly I'm saying after you're taking a meal? Why? Because you have the bile that gets secreted in response to this fatty meal for the digestive process, right? So bile is important for digestion or emulsification of all the cholesterol and fat rich components that you take in your meal. So it is important, for which your gallbladder has to contract, it has to contract, right? So it contracts to let the bile out. But guess what happens? It is not going out, right? Because there is an obstruction. So your stone is obstructing the cystic duct, your gallbladder is trying to push more and more, that is contract more and more, but it couldn't. So in this process is when you get the actual pain. So pain is a body way of telling, oh my god, please don't do this, it hurts, right? Yeah, so that's why it is the first signal from your body that it says I can't do it anymore. Okay, right, now coming back. So biliary colic is such that it's the pain from the gallbladder contractions after you take a fat rich meal, but that gets eventually resolved within 4 to 6 hours. Okay, within 4 to 6 hours. So if it didn't resolve, like if the pain is constant more than 6 hours, like for day even, then you have to think about a complication. A complication, what? Let me come back to this later. So right now you understood, right? So biliary colic is a constant right upper quadrant pain after a meal that happens because of your increased gallbladder contraction in an effort to let the bile out in order to help you digest your food. Okay, but what is about ACC? What is about ACC? Acute calculus cholecystitis. Why? So after a repeated episode of biliary colic, so you can consider this as symptomatic gallbladder disease. So it's a symptomatic thing now. Why is it important? Because based on patient's symptom, like whether he is symptomatic or asymptomatic, your management differs. That's why. Okay, before that, how you should differentiate? What differentiates biliary colic pain from acute calculus cholecystitis in your case presentation? Or even if you are just dealing with a patient who comes with, let me just clear this, it's just going clumsy, so you may not get the actual thing right. Okay. So let's suppose that you get a case or you are meeting a patient who's having a severe right upper quadrant pain that lasts for more than 6 hours, and he has associated nausea, vomiting, and also he's saying that the pain is radiating to the back or to the shoulder. Don't think about heart attack, bro, because the pain is in the right upper quadrant. Okay, so and also this is because of what? Because of visceral innervation. It is due to the what? Yes, phrenic nerve. So I will just try to integrate here and there the association so that you have everything just understood like a story. That's why. Okay, so like this your patient presented, and also yeah, he is having fever for the past few days. So he is having fever, nausea, vomiting, pain, radiating nature. All these things should let you think about acute calculus cholecystitis. And also if you do the labs in this patient, what you see? It is inflamed, right? So fever is a sign of inflammation. So if there is ongoing inflammation, of course your total count will increase, your white count will increase. Okay, but in biliary colic, will you see that? Will you see lab abnormalities? No, possibly it is not. Okay, so you don't have fever in biliary colic, but you do have fever presentation when it comes to acute calculus cholecystitis. So now what is the complication? What is the complication of biliary colic? You can consider biliary colic has over a period of time, over an episodes, for a prolonged period of time, this symptoms now progressively developed ACC. So that's actually a complication, right? So I hope you understand what's the difference and how a case will be presented in biliary colic and ACC. Just take home point, biliary colic pain, the same location for both of them. There would be nausea, vomiting, there would be radiation in both conditions, but the difference is the duration of pain and the lab values and also the fever presentation. Okay, so that actually suggests you something more important, something more critical is going on, and that requires an immediate attention. Okay, right.